Now, in your career, the chances of you seeing inborn errors in metabolism are not very common. Okay, so this is one of those this is a zebra school. Okay, so when you hear this discussion, we're going to talk about zebras. We're not really talking about horses. That doesn't mean that you shouldn't have that in the back of the mind, but one of the things that I got also told when I was a student was always think, if you hear hoofbeats, if you see a cloud of dust, if you hear and smells like a horse, it's a horse. It's not a zebra. Okay? So even though you may listen to these lectures over and over again, the chance of you seeing these are pretty rare, okay, which is good. Okay, though there's inborn errors in metabolism. The ones that are rare, especially porphyria, which we're going to talk about first. The ones that are not so rare is going to be like gout, hyperlipidemia, can be an issue as well, carbohydrate metabolism, amino acid disorders, mucopolysaccharidosis and gangliosidosis. I mean, I can name you the number of cases I've had that exposed to this. So maybe one case in my whole career with amino acid disorders, and like 2 or 3 cases with mucopolysaccharidosis. Now, those are diseases that occur in children, and they die early. Okay, that's why we don't take care of them here, because we're not a tertiary pediatric hospital. If you decide to go into pediatrics, then you're going to see a lot more of these 4 disorders in the end. These are more in children that are rare, have rare disorder syndromes. Most of the time, they don't need to go to the operating room, so you tend not to see them anyways. Okay? Porphyria, on the other hand, is one of those things that in anesthesia, you sort of should know at least some of the basics. Porphyrin is actually a pretty important chemical in your body. It's responsible for the ability for the hemoglobin molecule really to work. Okay? So porphyrin was actually first described in ancient times as a dye. Okay? It's an organic molecule produced by the mitochondria and cytoplasm. Okay? It's a pigment. It actually makes purple pigment. Okay? It is such a rare pigment that guess who decided to pick up that purple was kind of cool? Royalty. The only people allowed to wear purple were royalty. Okay? So if you were caught with wearing purple, you were dead, unless you were royalty. Okay? Now, I can tell you purple was really rare, too. It's hard to find as an isolated compound. Okay? So for many, many years, people didn't know really what was a porphyrin really. They knew they could get it from certain things. I think the porphyrin that people used in the ancient times comes out of a mollusk. And that's what they dyed the clothing with. I have to go back and look that over. It's been a while. It binds to metals to form complexes, which is where the iron binds to. And it's 2 essential molecular families, a heme family, and here's what a lot of people forget, which is the next part, cytochrome P450. Those are pretty important. Heme is pretty important in itself. It's of course, your hemoglobin carrier. Okay? But also important is P450. P450, of course, is a big part in your cells, but it's even more important in the liver. It's extremely important for metabolism. So porphyrin, porphyria, is basically excessive porphyrin in the blood. It's due to a group of inborn errors in this heme biosynthetic pathway. Okay? Remember, heme is a porphyrin used to make hemoglobin. When you look at hemoglobin, it's broken down into different components. It's got heme, which is a porphyrin, plus protein, which is essential for oxygen transport and storage. One of the first enzymes that are really important for this is called aminolevulinic acid synthetase. It's a mitochondrial enzyme beginning the pathway, and it receives negative feedback from the heme, which is the end product, to shut it down once it's producing too much hemoglobin. So it's an inducible enzyme. What does inducible mean? It can be stimulated. Okay? So that means I can expose it to something chemically or to some hormone, and I can induce the enzyme to become more active. Okay, so here's a nice picture of the actual hemoglobin. Heme is components here, and then it's got the protein surrounding it. and it makes this three-dimensional object that we consider hemoglobin. Okay? Inside the heme is where the iron's at. So heme is pretty important in holding that iron. If we change our heme, which you can bind different kinds of metals. We're kind of weird in the sense that we use iron. Okay? Other animals use copper as their blood. Iron. So it's kind of, iron it makes our blood red. Okay? Now, heme pathway looks like this. And please don't memorize this. Okay? If you want to, go ahead, but not needed. Okay? When I was doing biochemistry, we were required to memorize this stuff, but you'll forget it in about a week. Okay? If you do have, what I want you to understand in this process is it's a biosynthetic pathway that eventually produces this end byproduct, which is called heme. Okay? The first step is formation of glycine and succinyl-CoA. Okay? And then it forms amino-levulinic acid, and then it keeps all the way through this whole process, and eventually leads to heme. This side are enzymes. These are enzymes, which is not quite in the right place, but this should be up here. This one should be here. The one that I think you have to memorize is this one, alanine synthetase. Okay? Alanine synthetase, the reason you have to memorize it is because that's the enzyme that's inducible. Okay, the one that I got the arrow on. Okay? Now, each one of these enzymes, let's see, did I get that right? Yeah, alanine, okay, yeah. Okay. Each one of these enzymes can be not produced properly. It can be damaged. Okay? And when that causes that problem, you can never not have all of the enzyme. If you don't have any of the enzyme, what will happen? You won't produce heme. Okay, so this is a problem with that the enzyme is not perfect in the sense that it cannot produce enough of the product that you need. Okay? And when you start doing that, what happens to the product behind it? It begins to be produced in higher and higher amounts. And it's no way of shutting off the first enzyme because what shuts it off is the end product, heme. So it begins to believe, hey, look, keep producing more stuff because I know I'm not producing enough heme. So along this pathway, one of these agents is going to begin to accumulate when I have an enzyme problem, or what's called an inborn metabolic disorder. Okay, I'm going to have a problem with the enzyme not working properly. But it's never that I don't have an enzyme. Okay, it's always that I have an enzyme that's not working to its full potential. Because if I had no enzyme, then I would be no hemoglobin and I'd be very dead. So you don't make it very long. Okay? Now, as you increase those levels, okay, you can tolerate it fine, okay, to a certain point. And once the compound, which is the one that's accumulating, gets to too high a level, it becomes a toxin. And that's when the person develops symptoms. So things that can induce the enzyme, which is make the hemoglobin product go faster, which then causes that byproduct to increase and accumulate, that's when you start seeing toxicity. Okay? The other thing that's also where heme is important, besides the hemoglobin production, is this P450 or cytochrome P450 pathway. Okay? There's over 60 different enzymes that have the component of heme in it that is basically part of the cytochrome P450 system. Now, they are basically responsible for detoxing enzymes, okay, and they are made from porphyrin. Okay, so if you lose these guys, okay, then you don't detox well things that you're exposed to. So that's another issue in itself. Okay? So let's look at porphyria. Porphyria is a defective enzyme along the pathway. Heme production is impaired and the negative feedback is lost. So you get an accumulation of heme precursors, which then leads to that symptom of elevation in that porphyrin level. Enzyme deficiencies, not absolute deficits, which I just told you about. Okay, and alanine synthetase, okay, is inducible enzyme metabolized by the P450 system. So again, that's an enzyme. I've already repeated it 3 times. Do you think that's going to be an important question in the test? And I would say so. Okay. Now this is your actual biosynthetic pathway. Okay. The reason I've drawn it here for you is that this didn't come out very well, but in the gray zone area, those are the enzymes that are inside the mitochondria, and then there's also enzymes that are outside here in the cytosol. Okay. Alanine synthetase is a rate-limiting enzyme. It's found inside the mitochondria. Okay. That's where the actual, when you have heme being produced in high enough amounts, it comes back and inhibits alanine synthesis from producing any more compounds. So there's 2 classification systems. It could be based on the site of the enzyme deficit and the major sites of heme production, so it could be either hepatic or erythropoietic, or development of symptoms, which is acute versus non-acute. Usually acutes are very life-threatening reactions induced by certain stresses or drugs, and the only acute forms are really relevant to anesthesia. The other ones are not. Now let's go through them. Okay, let's go through the first one. Acute porphyria. Okay, that should tell you right away. It's acute and it's anesthesia important. Okay, so that's one you have to know by the back of your hand. Acute porphyria is a non-sex-linked autosomal dominant with variable penetration. You have 3 kinds. You have the acute intermittent, variegate, and hereditary porphyria. And then you also have another one called plumbo porphyria. Plumbo kind of sounds kind of cool, huh? What does plumbo mean? What's plumbing? What was all plumbing made of? Why did the Romans fall? All the aqueductal pipes were made out of lead. That's why it's called plumbo, plumbing. Okay? Lead piping was what used to be used a long time ago, and even lead solder. So they think that's why the Romans went downhill, because they all got lead intoxicated over time. Anyways, plumbo means lead, so lead porphyria is lead-induced porphyria. Then you have the non-acutes. These are more things that you'll see for cutaneous. This is what we account for what's Dracula, which is vampirism. We'll go into that a little bit later. Porphyria cutanea tarda, erythropoietic porphyrias also cause problems. Okay, so these are the actual enzymes that are being diseased. Okay, and this leads to an accumulation of these certain things. So if you get plumbo porphyria, you get an elevation in the delta amino levulinic acid. Okay, if you get acute intermittent porphyria, then that means this enzyme here is shut down. So you get porphyrobilinogen that accumulates in high amounts. Everything behind it is low in concentration. Okay, so it depends on where the enzyme is in deficit or inability to work properly that you get accumulation of that compound. Now, an acute porphyric attacks occurs most commonly in women during the 3rd and 4th decade of life. Okay, it's precipitated by increasing alanine synthase activities. Okay, and you have to ask yourself, why would women be more prone to this attack? And the answer is because they're hemorrhaging. Okay, they have menses. Okay, so when they're hemorrhaging, they have activation of the alanine synthase activity from the decreased heme. So they get loss of feedback, increased porphyrin induction, and then some kinds of exposure, they get P450 induction agents to induce and increase alanine synthase activity as well. You can get into fasting, stress, sepsis, and dehydration will all cause acute porphyria to be activated. Okay? The most classic 2 individuals in the world that we think had porphyria, one was Van Gogh, and the other one that's actually very important for the production of this country was King George III. King George was the one responsible for making some very, very bad decisions about the colonies and trying to enforce rules, and as a consequence, the Revolutionary War was initiated. And during these time periods of the Revolutionary War, he needed to make some critical decisions to basically terminate the war and win, and unfortunately for us, unfortunately for the British, he was having porphyric crises and could not make decisions. And it slowed down some of the military intervention. Interesting, though. What these people all got was the same kind of symptoms. They get abdominal pain. Okay, their porphyrin levels, the porphyrobilinogen levels get high, and it causes abdominal pain. The other thing that's kind of cool about this is they start urinating purple. Think about that. If you're a king and you're actually urinating purple, man, you really are royal. Okay, so you don't know if the doctors those days, maybe it's just because he's a king, you know. But they did see it. They did see that in King George. They noticed that his urine had turned purple. They didn't know exactly what it meant at the time. It also causes autonomic nervous system instability, electrolyte disturbances, and it really causes neuropsychiatric problems. Okay, people go into psychotic breaks. Okay, people will cut off their ears, like Van Gogh will do. Okay, or they'll start self-mutilating. Okay, patients will start making bad decisions. Okay, it can cause skeletal muscle weakness to the point that you go to respiratory failure, and then you have to intubate them and stabilize them. Things that can actually trigger it are agents in the operating room that can induce alanine synthetase would be barbiturates. So IV barbiturates are really a bad idea. So thiopental, thiametol, methotrexate are very high-risk cases. Also, etomidate is a bad idea. And benzodiazepines are unlikely, but I would not give it to them. Okay, you may still have triggering. There's question about it. Okay, the things that are considered safe, okay, are nitrous, IV anesthetics like propofol, ketamine, analgesics like morphine, fentanyl, and acetaminophen and aspirin are considered safe. The neuromuscular blockers are considered safe, and your opiate antagonists, if you need to use it, are safe. Cardiovascular drugs are considered safe, and cimetidine is safe. Okay, so really, thank goodness we've gone away from thiopental, and it doesn't cause acute porphyria anymore, but look what we still have a problem with, etomidate. Okay, and that can be used in emergency situations with somebody with acute abdominal pain. It could be a reason why you're using it. So now you're going to induce it. You're going to induce the enzyme P450 system, and you cause the alanine synthetase to activate its activity. The other one things that also will cause it is fentanyl, okay, and nifedipine will also induce it. Sorry about that. If you look at the acute intermittent porphyria, which is the most common one, it's a defective porphyrobilinogen deaminase, which is, don't memorize that, please. And it accumulates. This one you do, I think, is porphyrobilinogen. Okay, that's where they usually ask that question. And you get the most serious symptoms, which is central nervous system, peripheral neuropathy, hypertension, renal dysfunction, and it's most likely to be life-threatening. It's most likely to kill you. So here's where you find it, okay, which is a weird distribution. I've only seen one case of porphyria, and that was in my residency, and I have not seen one since. But apparently there's a high concentration in Texas, Virginia, North Carolina, and Illinois. Then you have variegate porphyria. I think I'll stop here. We'll stop in variegate, and we'll continue on variegate next week. Okay? All right. Any questions?